Annie, bonjour, hi. Je m'appelle Lila Cashew. Je suis directrice exécutive de Hondegonson Doge, l'environnement réseau pour la recherche sur la santé des autochtones du Québec. Nous aimerions commencer ce webinaire par remercier tous nos panélistes qui ont accepté de partager avec nous et avec vous aujourd'hui le travail.
So would like that order. So thank you very much for all the panelists joining us today. We will also like to thank all the people that are here today and are sharing our interests in order to feed and share some discussion regarding the research environment. They are by the community and for the community. We are on the territory Gadiganagak. Like our spectators and our different participants are come from different territory, different areas. We are inviting you to share in the chat the other indigenous community or territory on which you are today. Thank you very much. My name is, I'm assistant in research. My name is Adrien Deschênes. We're reminding you that the simultaneous interpretation is available. If you look on the bottom of your screen, there is a globe. Maybe some of you, if you don't have, there's 3 little dots. It's called More. It is a little square, 3 dots at More. Click on this and you will have the interpretation option available. There also the chat. So in the interpretation, you'll be choosing the channel of your choice. So thank you very much, Leila, for the introduction. Thank you very much for the 3rd webinar for the ERRSA-Qc-NEIHR production. So we have either projects that are totally led by organization, indigenous organization, and community, or different organization and institutions that are related to the indigenous people. We are very happy to have 2 projects very different today, but they are necessarily quite appropriate for the research in Quebec. So our first guest today is Oscar Labra, which is the holder of the Strategic Research Chair in Health and Indigenous Perspective in UQAT, and he will be accompanied with Ernest Penosway, which is a men's mental health worker in Lac-Simon. And since it's a cold period and other winter and respiratory disease, he will not be with us today. So we will be recording the presentation. So we will be able to join it with the video also that we're presenting so that you will be able to view it. So Oscar, I think it's up to you right now. And thank you very much to be with us today. Good afternoon, morning to all. I will try to share with you my PowerPoint. I will share my screen. Can you see this very well? So thank you very much, firstly, for all the information. It is very interesting for me to allow me to share with you my experience and my partnership in the Indigenous research. Today, we wanted to end with me, but since my colleague is not here today, he's not feeling well, so he was not able to participate. So I will be presenting the slides for him. I will mostly talk about what is important for our research in partnership with the Indigenous people. I will mostly tell you how we managed to develop this partnership with the 3 communities in the Abitibi-Témiscamingue region. I will share with you the experience that it was for us and all the people around involved in the research. So this is the first plan. It was a context of research, a methodology, and a process of the research we have with our partnership, and all the challenges that we have met and how we were able to overcome all these difficulties and the implication of these Indigenous partners and the process and the collaboration that we had with him and with all these participating communities and the success and the results and the benefits that we had from it. I will start here. The context actually of the project, this initiative it was a socio-sanitary, and of course it does depend on the community, the revenue. Why are we looking at partnership with the community in the area? Why? Because a few years earlier, someone, I think, had developed a project to respond to the question, all their indigenous knowledge is very important. For this initiative, for me, it was important that the intervener or the health worker and the people for the community would like to work on very important questions. We wanted to see, I would have to show the people how to build the research so we could make it together. So that's why when I work when I talk about working in collaboration, I mean involving the family. And we'll see at that time what was funded and what kind of methodology that we will develop. How was it in the social working in Canadian environment? We explained how the process, the working process, how the meeting were, and what kind of a methodology was appropriate for me. I was not close enough. Before, it was rather me that was determining the topic, the theme, the issues, and the how. And then actually, all this knowledge I was showing, I was bringing to show them. But through after a few years of experience, we have developed a kind of research more communitary in the area. Also, we said, I'm interested in the health question, specifically masculine health, and maybe it would be very interesting to share it with the community and discuss with them and see, would there be something that would interest them? And I had decided it myself, but the question was just an idea. But it was necessary what the people perceived of they wanted to do in research. So it was the same thing the next time. So I decided to approach different health worker. There was a community like Simon. There are many of them that are working with the centers. And they're starting talking about this idea. Why can't we get interested of how come the men are not going as often as the other people to consult for your health? This is how the idea of my project came about. So it's a qualitative process for this project. So I start visiting the community and trying to identify what are the needs. With the contact that I was developing at that time, I meet with different health worker and Indigenous and non-Indigenous people that are working in the community. So I also had the opportunity to have access to the people with the band councils at the time. They decided to listen. They said, yes, fine. Maybe I would like to meet people in the community if you authorize me. I do work in a community. I work in a community with subjects that are affecting people. And I would like to explaining that I would like to develop with you this kind of approach, because at that time the population did not have that information. So that's how we make different community. We went to Val d'Or. I go myself in different community. It was just me that was moving around in different community, meeting people. I was myself doing the consultations. Actually, the implication and the research, right from the conception, the beginning of the idea, because I did not know what to do. I would like, if I can express this, I would like to do research on a masculine point of view for men. So I could be responding to this. Well, if I try to do something that's not working in a that doesn't work in a community, it doesn't help me. There's a lot of research that are interested in different subject, but they're not. People are not interested. I want to find a subject that would be interesting for the community and that would really bring something. So I was. So I built this project at UQAT, and people was consulting left and right around the different area. What we have to deliver to your share has to be profitable for people. There are many things that are working very well. The cultural knowledge, family connectivity. We always solicited for something that are not working properly. So I understand right away that when I did my first project, which I'm presenting today, right away, I could see that I share this information. Once I've gathered all this idea and finally decided what could we do in terms of research with different centers. So I've gathered all this information, but I was the one who was presenting the idea. I was the one who was sending all these documents to different partners. I'm the one who met them. And I keep asking them, is this what you want? What is working? Okay. So, and that's why in that situation, the building the relationship, I realize that then later on, it's fine. It finally took shape. So then, and later on, I will be talking to you about whether you like it or if it works or not. But I was happy. I was happy to learn another way of doing things. Because it's no use to ask to give something to the population that subject that are not interesting or not interesting for them. They're not interested in. We need to develop research that the idea and the need comes from the community. I think that it is important. This approach has to be from the need has to come from the community. So the challenge that we meet, by the way, the challenge, one of the challenges is the availability of the partners. I had to move around in Picogan and Lac Simon, Akitaki a little bit. Sometimes people were not available because they had some meetings for themselves. They have other kind of even I had some meetings. Sometimes there was some election at some point. I had different kind of obligation. I cannot respond at the proper time. Climate conditions are also available, you know, in Quebec. Sometimes the climate might be too difficult for me to move around. It is not like in Montreal and Quebec. We could drive around, but when you have to go to some community, it's not. There's some snow problem issues, and sometimes we need to cancel the meeting because of the snow. And sometimes I talk about different disease. Some people were sick, people were not available, so we had to cancel the meetings that we had. So we had sort of delays. I'll talk to you about other areas later on. In order to overcome these challenges, you need to build trust, and I knew it ahead of time to build confidence. It's very important. It's a key. You need to develop this trust. All these connections based on trust. It's important. When I was sometimes in community to ask people questions and interrogate them, you have to demonstrate to them that you have honest suggestion and you like to get their contribution. Sometimes you have to develop it through your communication, also to your reputation. And it is important to get close to the development of each community and also change the strategies on convocation. Sometimes it was not easy. So I've learned that we had to change our way of meeting people. It's better to make yourself known by the community. At the time, I was the only one who was visiting, so it was important for me that they should know me because they have no idea who I was. So for me, it's important to introduce yourself and get acquainted with the people. Oh, wait, above the diplomas and all the expertise that I've developed in the university, that was not me the expert, but it's on the subject and the way of working. I work with different social groups at the different international level. No matter the subject you're presenting it, it's not necessarily you, but it's the people that are part of the group. They are the expert. Us, we're expert in methodology. We are an expert in the processes, perhaps. But the expert on a subject, it's not me. I could read things, I could find information I want to understand. But he said, the idea is to try to understand, reflect. In epistemologic approach, it's more friendly. But it is true, I'm not an indigenous person. It stops there. But I agree with them. I'm trying to understand them. We have very different implications when we talk about the implication of the indigenous partners in the process of research. It was built by international leaders and the different health workers, different participants. They are the ones who gave me the ideas and showed me how to do, and the implementation of the project in the community. Once that we have started develop the project or talk about it, of course, I have met people ahead of time. I've met the band council, say, well, this is a project that I would like to bring in the community, and here are the results. I will defend and I will need your participation to reach some people that would be eligible for the work and in this project and implement this project. This is how you have to work. You At the point, it was interesting because the subject was to get interested in the people in the community, the women in the community. So we had to make sure that we had we hired some students at that time, grant students at university, so they could develop their research, and then that's the collaboration we had. So with this collaboration, people in the community were in the different step with us during the research. So the implication, it's a question of the differences, the variation of our different lodges. Of course, it's me that introduces the liaison agent that collaborated with us. They collaborated with the people of the community to have, because we needed those both people to have access to the participant, the available or community and the people in the community. They were key agent in the project, actually. They say this is the first three where we afterwards could communicate with people. We have to validate the results as well. They presented the results of the partnership. He presented his data. We shared all the data and we presented it to them. It's a process that takes time, actually. And once we get the results and made the brochures and so forth, we need to diffuse the information and the results. I'm not working like I used to work as a researcher in another project, but right now we're working with the community. We could go if people are interested. If people were not interested, we're not forcing anyone. Because in order to diffuse the results, we have to be able to also distribute tools. In Picogam, we have developed a brochure. We'll explain to you quickly. The brochures, they were built with different interveners in the community, with the communication, and also other participant community. At each meeting, we were getting involved with all kinds of variation. No matter what the differences was, we did go to the community. This allowed us also the variation, allow us to develop different tools. In the brochure, it was also built through always by the bank. First, you need to approach it by the bank council, and then afterwards, you can get in touch with other people. And then when you present it first to the bank council, here, this is my research, this is what I would like to do, and this is how the people, the health workers that will be working with me. Can you? Oh, we had a meeting with them. We met with them. And the success, the benefits of this, you also already discovered where we got the fundings. We got the funding from for our research from this organization. We were very, very happy. This is the approach we chose. Because sometimes it's a shock for people because I'm a non-agent, but you have to learn to give them a voice. And this is what we've learned from the people we have consulted at the time. I wanted to develop the question on what should I be interested in? Why should I get myself interested in? So through this research, it allowed me today to talk about the different communities. And each time I have the occasion, I go and visit my partners. I say hello. Each time I go with them, I take the opportunity. Do you have anything that you'd like me to do? We sit down, have a coffee. And not necessarily go and find something from them, but to develop a trust connection. And it's really, it's fundamental. It's at the base of the research if you want to build a partnership. If you really want to respond to an honest research that would respond to the community's need, and this is what I do today, the people that I meet in the communities, they feel that I do it not only to write down publications and this. No. I do it for that this would contribute to something, that they get benefit from it. Humility also. Humility, the expert is not me, as I said earlier. I'm non-Indigenous. So regarding the access and the knowledge, I don't have. Sometimes I might have good ideas, but I'm not so sure. I need the people to participate to this research. The research that we have done with the students really reflects the and my last slide. What are the benefits considering the needs in research for the leaders and health workers and the community participant? It's like today we come and tell you that we have their approbation. I hear a lot of a call getting back. Oh, we're very happy. We're very happy. So this has done through developing like a trust bond. So, and really focus on the facilitating factors where access to the service is easy. They should be winners. It should be make easy. Why are not going? Why are they receiving services that are not so good? No, there must be something good happening regarding that. And this is what is my approach. So that's why when you give the brochure back to the community, they could see how it could facilitate their access to the service. So this way they were getting interested in that kind of research that we wanted to build, so to make sure that they would get easy access. Everything has to return to the community. And the students that were interested in the research, it's a student from the second cycle. Well, he didn't want to do the research just for university. There were people that really wanted to do this to be able to deliver changes and get better benefit and make it easier for them. And this is a copy of the brochure that we distributed. And well, it's not me. It's not me who did that. It's my student. It's a different research. See, they have the name here. Hélène Porcello Schurcher. Yeah, that's her name, Porcello. I would share her info.
Voilà. Donc ça va mieux comme ça.
This is much better like this, isn't it? You see? We had a presentation on what is a question of research? What is research? It is interesting, by consulting people, we were able to respond. And this is what showed through our research. What influence? What is the path and the process in order to have access to the services? And then we presented the results along with the path, along the process. It has to be clear. The health workers sometimes they need something clear. Not only the health workers, but the people in the community. They need to have a clear vision of what it is. We have here what are the favorable conditions for the use of the services, social health and services for the men at Anishinaabe. I know we're trying to go in the same way. And so afterwards, we'll have a second brochure, but this is the recommendation. And the key principle to accompany the men and Anishinaabe men, I will share with you a little bit later. I will give you a copy of this brochure so you could really, because all the information are on the brochure, so it will be easier for you to understand. All the services accessible for men, for Anishinaabe men. This is all about it.
Bon matin, mon nom c'est Ernest Penosway.
Morning, my name is Ernest Penosway. I'm an animator and a helper for the Centers of Youth. Recently, I've worked with Oscar, very nice person. We researched some people of our community. We had about 10 participants. It wasn't easy, but I still managed to survive. The implication in involvement of men is very difficult. So we found it very beneficial for all of us. Of course, we send us back the results of the research. I need to find out why I should align myself with the men in my community. There was a lot of sharing, and it's very interesting to hear the other people sharing. I work with Oscar, and I'm really happy to be able to contribute to his research. It allows me as well to grow within this experience. I don't know exactly what to say this morning regarding this, but I really, really like to work with Oscar. And if there's any other things that I could do, I'm really there to help, to sustain and support his research. It is something special to work with men, specifically in our community. It's very hard to go and find them. The youth is very difficult to get them to be active, and men in general have a hard time expressing himself. It's fine to talk about the facts and sort, but to talk about themselves, it's something else. I can do it myself. I manage to do it, but I would like to help others people to express themselves about their needs. What's worked better in my community, within my activities, it's cultural activities. We go in the woods, fishing, hunting, and there's also sports. Like hockey, volleyball, broom ball. The men enjoy exercising and enjoy themselves in sports, but they forget. They don't like to talk about their emotions. There are different parents and children activities. It's interesting. I think the men are better in their different activities versus their emotions. I started in 2010 to this position when I have, today I'm animators with groups of men. And I really, really enjoy that. I will never let go of this work. I really love it. And within the research I've been through, I'm really trying to listen to the men's needs. We never end listening, working, going through new experiences. And this is how I see life today, to be a man, what it is. What I was before, I will share with you a bit of my experience. I was really alcohol independent, and since I'm into this position, it's really helping me. And it will be almost 14 years right now that I'm not drinking or using any alcohol or so forth. So, and I really meet a lot of people on my way. They're hard. It's very rare that they come to see me where I work. I cross them on the road and I try to be there to help them because it's up to them to find their healing path. The healing path is it's long. I'm always in the working on my wellness and on my path. I'm improving myself every day, every week. It's continuous. I don't judge them how I wish for them and hope for them and to find themselves along this road. I'm just there to help them. This is how I am. This is how I work with the men. I don't know what more to say, but this is what comes out of me today as I'm sharing it. This is what my heart is telling me. If there are other things that I could share, for instance, but I think that will be all for today.
Avez-vous une copie, Ernest, avec vous du livret qui a été produit dans le
Do
cadre
you
de
have any
de la
booklet
recherche?
with you in the framework of the research that was? Oh, I don't know where I put it because there was a booklet in reference to the research. Is this what you're talking about? Services accessible to men Anishinaabe? Yes.
Peut-être que tu pourrais nous parler un petit peu sur ça?
Est-ce que you could talk to us a little bit about this? I think it was really, really well produced. But there are other things that I would like to add. For now, I'm very happy about this booklet and pamphlet that you produced. It will help me a lot in my work. It was well done. You know, the Anishinaabe men, they're special. We forget about them. We forget about them as Anishinaabe. And our wounds and heart difficulties come from far. We need to find our values back again. And one of our mission, this is one of my purpose. I'm really happy about the document that you've produced. There's nothing negative that I could say about it. I really want to thank you a lot to think about and thought about us, our community. We always have so much work to do yet.
Et voilà, et je termine avec ça.
And that's it. I end with this. I finished my today presentation. Thank you very much for your time. Thank you immensely. It's like a booklet, like yes, it's a pamphlet. It's really beautiful to see all the different steps that you have described and that you put in action. I think there's a lot of people that would really be interested to see this little pamphlet and descriptive presentation. I really like to see that they were very a changing of paradigm right from the beginning, the way you mobilize all the band council and the community around this approach and this idea. Yes, I'm really happy. I'm very happy that you talked to us about it and they came today to present to us this project. And also all the communities that were gravitating around this project. Thank you very much. I will send you paper copy. Yes, paper copy. PDF or paper, right? Paper. Whatever you like. Our next guest, Christopher Fletcher, with the Department of Social and Preventive Medicine from Université Laval, and Carolyn Stone from Qavvivik Inuit Family and Community Health Centers. This is another research project that
lets you take over the stage. Where are
Thank you. Sure, why don't, so there's actually three of us. Laura McKean is here with us today as well, and hopefully we'll have a bit of time to hear Laura's contribution as well. But why don't we introduce ourselves a little more thoroughly? Carolyn, do you want to start?
Yeah, sure. My name is Carolyn Stone. I'm an Inuk from Inukjuak on the Hudson Bay coast of Nunavik. And currently I am the interim executive director for Qavvivik Inuit Family and Community Health Center, the first Inuit specific health center in Quebec. And yeah, lots going on, but I'm sure you'll hear all about that very soon.
Hi, I'm Laura McKeeman. I'm working on the ERRSA-Qc-NEIHR project and also with Qavvivik. I'm studied psychology, social work, so I'm supporting the mental health services and emotional support needs during the survey.
So, and my name's Chris Fletcher, as already mentioned, and I'm professor in the Department of Social and Preventative Medicine at Université Laval. Background in, well, I'm born and raised in Montreal. I'm I'm a white guy, and I've been working for pretty much my entire adult life in Inuit communities in one way or another, or Indigenous communities in the West when I was living out West, First Nations, I should say. So, this project that we'll talk about today is kind of part of a lineage of work for me that's been going on for a long time. And all of which has been done in the perspective of community-based and sort of what the NEIHR is calling practical-oriented research. So it fits well within that. My training's in medical anthropology at Université Laval, and I spent 10 years in an anthropology department when I was in Alberta. Came back to Quebec City 13 years ago, and to take a position in medicine, where I'm kind of the social guy, I guess, in the department, which many social scientists find difficult in medicine. I've actually really enjoyed myself in that position and have been able to be involved in lots of very interesting things. So, and in terms of working with Inuit in the 1990s, I was the first in Nunavik and Qavvivik, where I started working on customary adoption and relations with health services through that, and a variety of projects since then. So today, we haven't had time to coordinate ourselves here, the three of us, so it's going to be a bit improvised. And I'll try not to talk too much, which I tend to do sometimes. And I do have a PowerPoint, but if you if you have any questions, just stop me and let me know. So I will share my screen. I think that's the right one. That looks good. So thank you, Oscar, for your presentation. I mean, listening to you, it's amazing how we've never met, strangely enough. But there's a great deal of parallels between the way that your work has evolved over time in the Abitibi and the way your engagement with community has evolved, and how our work has happened as well. And I think it's there's a variety of things at play there. There's people perhaps like us who are ready for those kinds of ways of thinking about research and thinking about how to do things in a more meaningful way to communities, and so that's good to see. Also, a strengths-based approach, which you talked about, is absolutely something in my career I've always tried to focus on, and is part of what we're working on together these days, or part of the vision. And also, I was very impressed by your resources guide. I mean, we put together a resources guide as part of our project as well. And I think your graphic design is really nice compared to ours. We should talk about that at some point. But anyways, it's very interesting to see how these threads are emerging over time. It's a long title, and we're talking about 2 or 3 different things here. But so the project is Qavvivik Inuit, how are those in the south, which is a health survey of Inuit living in southern Quebec, and its connection to Qavvivik Inuit Family and Community Health Center, which is a new organization created about a year ago. A little bit more, and which has offices since last May in Montreal. So quickly, the objectives of presentation today are pretty simple. It's just to talk to you about the project and the creation of Qavvivik. Nothing more complicated than that. Oops. And so what is the project? So it's CIHR funded majoritarily. We also have funding from ArcticNet and ITK, which is the National Inuit Political Organization. And it's a 5-year, for the methodology, it's the 5-year sequential qualitative, quantitative, mixed method, community-based, action-oriented study, which means that we started with a qualitative component to the study that was quite involved, even with the constraints imposed by COVID. On our ability to actually meet with people, and we used that qualitative phase to develop a kind of nuanced and deep understanding of the issues facing the community generally. Many of those are health specific, but not exclusively. And I'll get to that in a minute. There's a bunch of things in the chat. Is anything okay in the chat? Yes. Okay. Whoops. Sorry. I'll go back. Being slightly odd. Give me 1 second. There we go. So the qualitative phase was to develop an understanding and to build some quantitative survey questions out of, and we've been doing that for the last, I don't know how long at this point, quite a while, coming and going. And so the overall objective is to describe the health of Inuit living in southern Quebec with the goal of informing the development of health services that are culturally appropriate and targeted to Inuit living in the south. CIHR requires that we identify designated knowledge users. So Qavvivik is the principal knowledge user, and Qavvivik is also a knowledge user. Qavvivik is the Inuit Land Rights Corporation for Nunavut Inuit people from northern Quebec. So, and we're very much, my thinking around this, I think, like Oscar's, is influenced by critical perspectives on traditional research, and particularly traditional critical public health perspectives. And this is a quote from an article that, it's from 1998. It's a long way back now, but it really had an impact of changing the way that we think about the nature of research in Indigenous communities. And just a little quote from that is: traditional systems of public health surveillance are dangerous to the aspirations of marginalized communities. I always thought this was a really confrontational thing to say. John O'Neill was the lead author. Jeff Redding, who was the first scientific director of the Institute of Aboriginal People's Health, and Audrey Leader, made this statement as very much to challenge the way that things are done normally, and why public health surveillance, which is for public good, could be dangerous or undermining the aspirations of communities is an important challenge to us since then. That 20 years later is kind of operationalized by ITK, again, the National Inuit Organization, that is advocating for a national Inuit strategy on research, which is really more of a national political strategy on research, I would say, and who controls the mandates and who controls how the questions are asked and how they play out in this case in Inuit and Nungat, the 4 Inuit regions, but also I think influencing how we are conceiving of research that involves community very, very intimately. In short, research must contribute to self-determination of Inuit and empowerment of Inuit and moving things forward from an Inuit perspective. I'm assuming most people know where we're at, what we're talking about in terms of geography, but there are 4 Inuit land claim regions in northern Canada: the Inuit settlement area, Nunavut, Nunavik, and Natsiavut. Nunavik is northern Quebec, where there's 14 communities. And our study concerns Qavvivik, which means the people of the south, or the people of the sun, and most of whom live in and around Montreal, but there's also smaller communities in Val-d'Or, Gatineau, Quebec City, a little bit in Sherbrooke, and the townships generally. And I situate the work that we're doing on this survey in a continuum of research, some of it, very much colonial-oriented research in the 1950s to 70s, we could say, where the concern was managing and in fact directing social change in Inuit communities according to white standards. And there have been 4 now major regional health surveys in Nunavik, and a 5th one is going on right now. And each of those has its character, and each of those has its kind of culture in itself, I would say. Those surveys are important. People often say, well, what's the point of another health survey? Well, it's often not terribly obvious what they're doing, but they are having an impact, and they are orienting how resources are spent, allocated, and how questions are asked, and what priorities are set in government, even if it's not very obviously done. And that you can track historically, and this is part of what I'm working on my sabbatical, which I'm on right now, is the history of health surveys, which is a very arcane subject, but one I really like. Including this report from 1960, Eskimo Mortality and Housing, which really had a massive impact on how communities are organized today. And indeed, the creation of some communities was done through this report. So health surveys are at once kind of a bit obtuse documents, but also can be quite meaningful and quite impactful on people. So here's the different surveys over Nunavik health over the past few years, or past few decades. And the most recent one, Qavvivik 2017, which Laura was involved in, as well as myself, was the first that was commissioned by the Inuit Health Board in Nunavik, and had some interesting innovations in it, including the creation or the mandate for a community component to describe health from a community point of view, and that was something that I was involved with. And to be honest, I'd never really been interested in working on health surveys until the mandate came from the North, from an Inuit organization, and had a true cultural and community perspective. I don't know, Laura, if you want to say anything about this time and this survey. I mean, you were more involved in the actual doing than I was in many ways, I think.
Yeah, I'm not quite too sure which angle to take on it, or which, to not go into too much detail, but I was working for the Nunavik Regional Health Board at the time, and was an interviewer for a month on the during while the survey was being carried out on the Amundsen. So I had firsthand experience of doing the questionnaire with the participants, how it was experienced, some of the follow-up of what happened, how participants found the experience, but especially with the other staff, a kind of mix of about half from around Nunavik and half coming from the south. And so I was able to learn quite a lot about what was done very well and some things that could be improved. And definitely that's all been taken into account by Christopher and Carolyn, and that I'm contributing myself as well, so that we can respond to that in this one.
Sorry to put you on the spot there. But you know, it was doing health surveys with people in a community is a very complicated thing. It's not a neutral experience by any means for anybody, and some people were very found it very difficult. So as I said, that's Qavvivik Inuit, which means how are we now, and UQAT and Ernest means how are those in the south. As I said, it's the first survey mandated by an Inuit organization. And there really is an important need to develop good data for strategic planning, for development of resources, for making the arguments required of health boards to governments to get the things that they need to do. And there's also a need to measure and track change over time. If we're going to invest in health at a regional level, we need to know whether those investments are paying off or working or not. Laura mentioned the Amundsen. I mean, the survey team, which was about 30 people. Laura, there's a large number of people. Yeah, something like that. We're housed on the ship. So this is, you know, one of the ironies of northern research is that you have to travel in an icebreaker from community to community. It seems a bit of an overkill, and it seems a bit odd, you know, to show up in what I often call the sovereignty machine in northern communities. And this is the Canadian flag literally floating around in the Arctic, but that's another story. But out of the community component, we were able to really develop a cultural perspective on what it means to be healthy in the communities, and that was our mandate. And so we were able to do a number of workshops in the different communities, and then do a series of qualitative and open-ended kinds of questionnaires in each community. So 14 communities, 3 to 5 people minimum in each community. So a number of interviews, and all that data was merged down, and a thematic analysis got us to a 3-dimensional model of Inuit health, which was sort of what we were asked to do. We were asked to provide a comprehension. Well, we provided this model that really is an Inuit model, and that was the fun of it. So there's 3 dimensions to the model, and I'll very briefly describe them. I think I have a little graphic coming up. Yeah. So as people said, I think in the first day of the first workshop, somebody said, if you have your culture and you have your language, you have the basis of health. So on our graphic here, we have the soil or the ground on which health emerges, which you could say is the ontological foundation of health, is culture and language in Nunavik. And there are 3 interlinked concepts: Ilususialnik, Hanungitsjalnik, and Inuvetikitsjalnik. Ilususialnik refers generally to a kind of bodily health, which is defined and described through a cultural lens. It's not directly translatable, but it's close. Hanungitsjalnik is a well-being kind of concept that has fleshed out in the model, and Inuvetikitsjalnik is a social health, and very much concerned about the quality of relations between people in the community, within the family, within friendships, with political organizations, and with non-Inuit as well. So a 3-dimensional model onto which 8 social determinants or community level determinants were identified through the analysis. So that's the northern study, and that is to contrast with, say, First Nations medicine wheel type models, which are quite powerful in those communities, but don't really speak to how people experience health in Inuit regions. And to provide, again, another way of imagining health, again, somewhat like what Oscar's presentation was showing. The tree metaphor is a good metaphor, except of course in Nunavut there really aren't any trees, and it's not part of the cultural repertoire necessarily up north. So, anyways, the idea was to create something that makes sense for people in the north, and we've taken that model and used it as a way to structure our understanding and our study of health in the south. Okay, and so there's another important Inuit community. There's the 14 communities of Nunavik, and of course there's the people who live in the south, which we're now calling the 15th Inuit community. Carolyn, do you think that's an adequate thing to say? I sometimes worry that we're sort of not doing that.
No, you're doing well. I mean, for sure, we've been advocating for many, many years to ensure that we're recognized, the Inuit in the south, or the urban Inuit, as being a community that is as deserving as our Inuit in the north. There's a large population, as you know, Chris. But no, everything that you're saying, that is, of course, I'm following along. Yeah, it's good.
Okay, thanks. Actually, that maybe I'll just give everybody a chance. Are there any questions anybody would like at this point? I can't really see anybody. I could see there's a few people. If you have any questions, please feel free. No? All right. Okay. I will continue on. So, Southern Inuit community, there have been people coming south since at least the late 1800s. Interestingly, when Jacques Cartier arrived on the north, the space between the northern Newfoundland and southern Labrador now, he encountered Inuit who were there, which is quite far south considering these days for Inuit territory. Not only did he meet Inuit, but he met Inuit speaking Basque, which is a little known history lesson. So there have been contacts. We tend to think of Northerners and Inuit as being very isolated, and that's true to some extent, but it's not absolutely true. We've documented an interesting story of a crew from Baker Lake who came to Montreal on a busted up schooner to have it repaired and machined. The machine was a major boat building center at that time. In the 1960s, sorry, what's going on here? With the development of the art industry and carving, Burke's Jewelers downtown Montreal was sponsoring Inuit artists to work in their stores doing carving. 1967, they had the Qavvivik building in Montreal. But really, it wasn't until 1975 with the signing of the James Bay Agreement that the Inuit community in southern Quebec starts to be a permanent community and starts to grow. And it grows quite rapidly. Today, we're counting about 2,300 people. So generally speaking, this is a large community by Northern standards. And there's, I guess we could say, little coordination with community organizations in the south, although that's changing over the last couple of years, I would say. Relatively little interaction with services and organizations in the north because of the way that the James Bay Agreement structures health services. People living in the south do not have access to northern-based health services. So there's an irony that arrives where Inuit living in Montreal have fewer resources to help them with health than Inuit coming from the north and staying at the patient center at Uluvik in Dorval. There's issues, structural issues there that we really need to address. Inuit living in the south are often perceived by people in the healthcare system as strangers or not in the right place. They're sort of presumed to be visitors, which many are definitely not. And on the other side, a lot of Inuit coming south and moving south for education, for other reasons, experience the city as many people have said, as if it was a different country. People have asked us to try to develop immigration services, or the equivalent of, for people coming south. So that gives you a sense of how dislocated and complicated it can be for people coming south. From a research point of view, the health of Inuit living in the south has never been described. They've always been excluded from health surveys, again, because the surveys are based on a geographic distribution, a geographic territory, not on a populational one. And yet, between 2006 to 2011, the population increased generally by 18%, which is a healthy growth rate. But the southern urban Inuit population increased by 76.4%. So you have a lot of movement of people from the north to the south. And that's a very important social phenomenon. And it's one that in southern Quebec, at least, has not been recognized, or very few efforts until very recently have been made to do anything to work with that population. So again, Montreal population has been marginalized and largely invisible to public health authorities, even though we're estimating at least 15% of the total population of Nunavik now lives outside of region, most of them in Montreal. Excuse me. So that's the setup for the project that we're working on. I think it's you. So originally this was started as a partnership with another Inuit organization, the Southern Quebec Inuit Association. That partnership came to an end at the same time as roughly as the Qavvivik Center was created. And my headphones are dying. I'm just going to take them off 1 second. Right, can you still hear me? Yes, okay, good. So the objective of the project is to describe the health of Inuit living in the South for the first time. Across the country, there's only really ever been one other survey of Inuit living, health survey of Inuit living out of the region. That was in Ottawa, the Our Health Counts survey, which came out, I don't know, 5 or 6 years ago now, 4 years ago. As I said, it's a two-phase quality quantity study. The goal is to start supporting the community in the creation of Inuit-specific health services. And when talking about the survey and the project, much to my surprise, people often said something along the lines of and usually when you're working in any kind of research, there's a fair bit of convincing that needs to happen. People aren't necessarily really into research, but in this project, that was definitely not the case. So there's a kind of a readiness in the community and an interest in taking into account. So the survey, we did a number of things along the line, and we're just at the edge of starting the questionnaire. Validated the EQI model for people living in the South. Yeah. Audrey?
I just want to say that I think your headphones are getting in and out, so we have your mic in and out too.
Okay, sorry.
So
yeah, I noticed it's that like they should be off. They're in their case and everything, so I'm not sure what to do about that. Hmm?
I said scolded them.
Yes, that's it. 1 second. I'll just turn off. Yeah, they seem to be not doing that anymore, so I think it's okay. Sorry about that. All right, so we validated the EQI model for Sihinimu, which means that the basic concepts make sense to people here as it does in the North. The determinants are not all relevant to people living in the South. Like, for example, the land determinant is relevant to people in the North very much so, but the notion of land living in the South is not the same at all for obvious reasons. Oops, sorry. We did a census of the population, and we did the qualitative survey that I mentioned. The results were released in 2022, and we're in the process of finalizing the questionnaire. So the qualitative research report came out a couple of years ago, almost 2 years ago. And has a number of sections, which I won't go into because we don't have time, but so physical, mental health, access to health services, the sense of community and belonging in the South, relations between the South and North as they relate to health, and a lot of reflection on the role of identity, culture, and language in health. There's 5 recommendations. I won't read them all, but they're not ground-shakingly different than what you would imagine recommendations would be. But the first one was clearly needed before the survey. It's not a surprise to anyone in the community, but by the same token, research is sometimes an exercise in stating the obvious in new ways. And that's, I think, what we've done here with the establishment of an Inuit community health clinic staffed by community members, nurse practitioners, and family medicine doctors. I mean, that really is the most obvious need that was in the community, but the community has known this for well over a generation now. So there's nothing new there. But the survey and the research to date has been able to state that in a way that might be more palatable to people in government, but also it allows us to sort of make recommendations to ourselves in many ways, and that's sort of what's happened. So out of this process of research and working collaboratively and in full partnership with community organizations, the Qavvivik Inuit Family and Community Health Center was created, and it's created to respond to the needs that the community was already very well aware of. And from a research point of view, we're in the process of demonstrating, maybe with a bit more precision and the kind of language that gets resources mobilized. So, and that seems to be working so far. It hasn't been the easiest process ever, to say the least, but it is ongoing. Carolyn, why don't you say a few things? I have a couple slides here, and I'll just show you what they are. Looks like you need to close the curtains too there, Caroline. You're going
Right?
Oh, is it shining right through on
Yes,
you?
okay. There we go. Yeah, I can say a little bit about this portion of the presentation. Just to add into with what you were talking about with the survey, I think it's important to note that there was an awful lot of Inuit consultation with the survey, with the questions, with reactions that we may have. It's a long survey, but we had lots of elder consultation. It wasn't just put together academically, it was put together to ensure that the participants are treated with respect, that there could be some triggering questions, which is where Laura comes in, and to ensure that this is a healthy survey to do with our community. Much research that has been done in the past has not always been that healthy, not taking into consideration our unique culture and our unique past that could trigger good and bad emotions, but that it's all been done and reviewed by Inuit elders, Inuit women. So it's going to be a great resource for us to move forward with the health center. Qavvivik, like Chris said, we've only been around for about really in our administrative building for about 8 months, I guess. And I'd like to say we came out like a cannonball. We have so many projects on the go. We are Inuit led and Inuit run at all times. And there's no gray area with that. It's Inuit led, Inuit run. We have a very strong team. Right now we have projects, we look after our elders with the Elder Support Network. We distribute country food. We have navigator program. We have a language program. So we're moving quickly. Our ultimate goal is to open a clinic. If any of you are familiar with the Qavvivik in Ottawa, we'd like to be them. I actually go all that way to for any kind of vaccines or anything, because it's Inuit specific, and with the mistrust that our community has with the healthcare system, it's imperative that we give them a place that they can access respectful and fair healthcare. And we have an awful lot of people that are supporting us, doctors included, and Chris's colleagues, and our board of directors is all Inuit, very, very influential people in our southern community. So when we say it's Inuit led and Inuit run, it absolutely is. It is probably the thing I say most around this office, because it has to be. We all know what we need. We all know that we needed a clinic for the last 40 or 50 years, but it's never worked. So we have to do something different. We have to figure out why it didn't work. So Qavvivik is trying to do that. We're trying to ensure that, you know, my grandchildren can go to this clinic, that it will be around for a very long time for our community that is growing. So that's our next step, is to find our clinical space. So although the challenges have been great, it's been it's an amazing organization, and I think the challenges will will continue until the door is open to the clinic, but ultimately that's what we want to see. And we have a very strong team that's pushing it forward. But Chris's work with the survey is going to absolutely tell us what our community needs from our community. We're not going to guess what they need. We want to hear it from them. So once that data comes back, then it will absolutely be essential for us to move forward, to know what we need to offer our community from the clinic standpoint. Yeah, that's about it.
Okay, thanks. Great. Yeah, I think we've touched on much of this. You mentioned the Elder Support Network, support for women in the maternity center, resources for people, information resources for people coming south. You know, there's a lot going on. We have other things that are just on the cusp of being launched as well. So how am I doing for time, Audrey?
If we want to have a Q&A, I'd say it's a good time to start wrapping up.
Okay, I'm going to wrap up. I'm pretty much wrapped. So I'll just give Laura a chance to maybe say a couple things about what she's working on around the survey. I mean, Carolyn alluded to this, and I have as well, that surveys are not neutral experiences, and it can be very challenging for people to answer questions about adverse life experiences or experiences of family members and so on. So Laura, do you want to say a few words?
Sure, I'll do an ultra quick summary of just some of the main things taken into consideration. So certainly the importance of space and connection. So the survey is being carried out from and in spaces that belong to Inuit. So at Qavvivik, and we'll also be going to Inuit organizations in the South. So that already creates a certain amount of safety. And as well, the importance of connecting around it. So the purpose won't just be to bring people in, ask our questions, send them away. There's many things that are going to be happening, like a social space, hopefully with elders. Also, if they come with other needs at the time, they're very welcome for that. And then as well, we of course are taking into account the different traumas that may have been experienced systemically, culturally, historically, in community, developmental traumas, possible interpersonal traumas, by putting many emotional supports in place. So both, so there's a mental health professional team who will always be available for participants during the survey if they'd like to talk one-on-one, as well as they'll be welcome to come back anytime we're open, but we will also be providing them with both the resource booklet that has been created, connecting them to specific services that they need, and welcoming them to come back and see us anytime, and making sure that they're aware of 24-hour supports in place and available. But a hugely different step that this team has created is to ensure that staff are well supported as well, because many are triggered by many have experienced things that we could be asking about. So there's possible triggers there, as well as if you're with a participant who has been triggered, that can be very hard too. So rather than leaving them alone to cope with that experience, we're going to be working in group, have individual support available, and again, connecting to other resources. And then just briefly, in the design of the survey, great care has been taken to minimize potentially triggering questions to the minimum amount of information needed to develop services, rather than, all possible harm that could have taken place. And then also in the wording to word it in a way that we can get the answers that we need without reducing the chance that it could bring back triggers, flashbacks to mind. And then also making sure that the participant feels in control of the process throughout. So having an overview of what's going to be asked in the survey, because it was discussed that there has been so much research done and a nervousness around what am I going to be asked? What do you want to know this time? So they will be in control of that right from the beginning and throughout. will be explained that they can always say that they prefer not to answer a specific question, or even to skip entire sections, because we know that it can be triggering just to read a question, even if you then choose not to answer it. So there's many other things that we've considered and will be carrying out, but those are some of the main things that we're putting in place.
Thanks. Excellent summary. Okay, and so that's about it for me, and appreciate that chance to talk with everybody, and happy to answer questions, or I'm sure others are as well. Thanks. And I'll try to stop my share here. All right.
Well, thank you so much, Christopher, Caroline, and Laura, for this presentation. It's always nice to see how research results is tied to action, and how it has will help, the development of this center that was so needed, right? In the South, there's such a big population. Now we are opening the session for questions. Donc maintenant, on ouvre la session aux questions ou commentaires.
Now question and answers is open. Feel comfortable to ask question to the presenter, to the speaker. Anyone could ask question.
Bon. Ah, vas-y, Jean-François.
Yes, Jean-François.
Yes, hi. Are you hearing me well?
Very well.
Right. So my English is quite rusty, but the question will be addressed to Mr. Fletcher. My name is Jean-François Soucy. I am in I work for Quebec, where we host groups for men to share on individual basis. And one thing that I've quite appreciated from your presentation and that of Mr. Labra, sorry for butchering your names. How would the communities, like, from what I'm hearing, although both of your projects tied to the communities in this approach, which is something I highly value, how do you feel that the whole, like you said, when you use the ship to go around, like that big flag on the side of the ship was like telling of what's to come. How do you think the communities viewed an approach that has been like backed by the whole government, and how would their view on different initiatives would be viewed when there's a different flag behind them? Let's say it's coming from a wholly community backing, or it would be like provincial, federal. Is there like an influence in that part that you saw, both you, Mr. Fletcher, and Mr. Labra?
Yeah, sure. I mean, a very good question, and that's why I showed the picture of the icebreaker, because there is a history that is a colonial history and research. The two are intimately linked in the North, and everyone is aware of this. This is not a secret. And at the time, it was explicit. People were wandering around saying, we're bringing Canada to the North, and that in the 1950s, that meant a different thing than it does today. And I did mention Jeff Redding. As I said, he was the inaugural director of the Institute for Aboriginal People's Health at CIHR, and he's a Mohawk man. And he and others were able to really establish this new way of thinking about research and autonomy, and also to orient the resources, which are considerable in health research, to Indigenous communities and organizations and allies to some case. And in fact, the Quebec NEIHR, which is sponsoring our conversation today, is an absolute product of that process. For reasons that still escape me, Jeff asked me to be part of the whole process early on in that first 5 years. I was a very young researcher. I think it's because I knew John O'Neill, and John was working on things as well with Jeff. So I got to have a little picture of how this was happening at the time, and it was very interesting. And it's it's a generational challenge to change the way that research is oriented and structured, and what its culture is, and that's happening. So the idea of a principal knowledge user is a very important innovation as well in Indigenous health research. The research it's not just nice statements about working with community. Community actually has power over the data, and that's a very important step in the development of what you could call data sovereignty or research sovereignty by Indigenous communities for their own ends. There's a number of us out there. Oscar Labra is clearly one of them as well, who are part of that as allies, part of that movement, and happy to be so. That's very rewarding for me, and that isn't the case for everybody, and that's okay as well, So we're well along a road to changing that set of relations. The relationship between, let's say, Canada and Inuit is a complex one, and in many ways, Inuit have embraced the idea of being Canadians in a way that First Nations people, maybe not all of them have. I don't want to speak for anybody, but Inuit, have seen themselves as Canadian from early on, and have kind of run with that, and so that's their history and their decision. That said, when people regularly ask us, what are you going to do with the information and who's it for? And we're legitimately say we are going to help build these services with this information, and it's controlled by Inuit, and this is true. And that's a relief for me to be able to say that as a researcher, because it really takes the suspicion out of the matrix. Decisions will be made by Inuit about their health. I will help as much as I can, and that's my role as a researcher. Maybe Oscar, you want to add something?
C'est une question, Christopher, oui. Oui, en fait, j'ai bien apprécié ce
I
gros
really appreciate this big work that you are doing. Actually, the metaphor that you have put earlier around the slides. But my question was to know, they were told that it was a project by and with the community. I can imagine that you must have had challenge, difficulties. Like you said earlier too, I'm a white person. Yes, we cannot change that. It's the same for me. But through the years, I see that you did your career in research for many, many years. When you have a lot of years and a lot of experience, what would it be for you when you talk about this project? I know not all the collaborations that you had around this research, but some of them. How did you sort of get this collaboration? I think this is the question. I'm not sure. The question of partnership. It's almost a research topic per se. We have to wait that everyone is interested and accepted, but actually a partnership is like an animal in you. You need to feed it, you need to support it, you need to work at it. And the benefit that I see the more and more with the Inuit organization is the capacity is more present in the different organizations that it was, but nonetheless, they have a lot of success in the secondary and post-secondary education. It influenced a lot. It has a great effect. And so these are very legitimate benefit. I'm sorry, I've changed language for the translator. I'm sorry. It's okay. Yes, it's okay. Yes. Yes. Okay, don't worry. We started with another organization that I mentioned, but for reasons that are not yet clear, this relation just ended. I don't know why. There was a lot of disagreement, but it was very difficult for me and for Carolyn. So we said, no, it's no time to stop, even if they're moving off. We need to continue because the needs are more important than us. In a way, that was the most important thing. And we always had the support from the community. So I think they did even more. And there were a lot of expectation, of course, what they should be, what they can be, but sometimes the expectations are much greater and larger than the capacities. But anyways.
Chris, I'll just jump in. Since the beginning, it has been a challenge. And like Chris says, we put our community first. We always say for the greater good. So whether the challenges are monumental or small or one in front of the other for months on end, it's always for the greater good of the Southern Inuit community. So really, one foot in front of the other, and we just keep plugging along and we keep doing our work. And by doing that, we have done monumental work in the last 8 months, and will continue to do so. But the community always comes before us, comes before our staff, comes before everything. We're just working for that greater good to provide them with what we know they deserve and should have.
Yeah, thanks.
So we'll have to adjourn this webinar. On doit terminer le webinaire pour aujourd'hui. Merci à l'ensemble des panélistes.
We ended the webinar for today. Thank you for the speakers and the participants. Merci.
The translator. C'est vraiment un plaisir d'entendre les projets de recherche qui sont menés ici au Québec et les effets.
It's important to see all the positive spin-off that they had from these Indigenous people. So it ends our 2023 year, and we'll see each other in the 2024 in January. So have a nice holiday. Do not hesitate if you have time. There's a questionnaire in the chat. Please give us some feedback. That I would really like that. It was help us animate our activities. And thank you very much, Oscar, Christopher, Carolyn, and Laura. Thank you very much. It was a great pleasure to see all of you. Bye-bye.